This is the COVID Main OR Periop Guide. When you are booking a COVID positive case, you're committing to reviewing and adhering to the safety precautions we have placed in the COVID OR areas.
We will do a pre-op huddle for all COVID cases. This will take place by the signage noted here. This is located by OR 25, and we ask for everybody to gather here 30 minutes prior to the scheduled start time for your COVID case.
The COVID pre-op huddle mimics our regular pre-op huddle. The additions are that we are asking our charge nurse and our anesthesia board runner to be included. And it is important for us to make sure that we're reviewing the procedure. We have every special equipment that you might need for your procedure. We have blood in the room if we need it, any special equipment that we need, and if there's any additional patient concerns, we want to go over the plan for the whole procedure prior to us calling the transport team to bring the patient down.
After the COVID pre-op huddle is complete, the OR charge nurse will call the 8 West ICU charge nurse for COVID transport. At times, the transport team is not going to be immediately available. In this case, the OR runner, the anesthesia provider, and OR aide will don the appropriate PPE and transport the patient to the OR. The COVID elevator process can be guided by the 8 West ICU charge nurse or another 8 West employee. All COVID positive patients should be transported using elevator number 9. In this picture, you're going to see the process for using the COVID elevator. This process will be assisted by the 8 West COVID teams. However, this sign is posted in the elevator as well as here for review. The biggest takeaway is once you are done transporting a patient in the COVID elevator, it is important for you to call the EVS lead to make sure that they clean the elevator. For COVID positive patients, surgical consent is obtained through IMED and will be available online for the surgical timeout. Verbal consent is acceptable if verified in the progress note by the surgical team. Anesthesia consent is a verbal consent verified by attending and resident CRNA anesthesiologists. Designated signage is used on the OR door when an active COVID case is in progress. When this signage is in view, please ensure that you're putting on the proper PPE before proceeding into the procedure area. There's designated colored tape used on the OR floors to serve as a visual cue to outline the contained COVID areas during an active case. While an active case is going on, there should be limited movement in and out of this designated area and strict adherence to proper PPE donning and doffing. Please take the time to scan these individual QR codes. This will lead you to videos on how to don and doff properly, what the proper workflow is when you're inside the COVID areas, and other miscellaneous things that you need to know in order to take care of your COVID patient successfully.